Hello and welcome to the Carlson Orthodontics podcast for February 2011. I'm Dr. Sean Carlson, Associate Professor at the University of Pacific Arthur A. Degoni School of Dentistry, and I'm also in private practice in Mill Valley, California. And today is going to be the second installment of a three-part series of podcasts, the first which was done last month. And that podcast discussed dosimetry. And today what I'd like to do is discuss a little bit about risk related to dental x-rays. And there's a lot of things that we're going to talk about today just to kind of put in perspective where dental x-ray imaging lies in our everyday world of risk. So risk, of course, is classified as the quantifiable likelihood of loss or less than expected returns. And obviously all of us would like to avoid risk as much as we can, or the negative consequences of risk. And unfortunately, risk is part of everyday life, and it's just one of those things that we need to accept and, of course, try to minimize as best we can. These are all things that we can't really avoid, but what we'd like to do is avoid those things that we can and just kind of minimize our overall life risk. So quantifying risk becomes important, and the people in health physics, and most of the literature that I'm going to talk about today comes from the health physics literature, and one of the ways that we quantify risk is through something called loss of life expectancy, or LLE. And this basically is a way of putting risk in perspective and saying, what is the chance of you losing life expectancy based on this risky behavior? So the way this is calculated is, if you take, for example, a 40-year-old with the average age of a living human to be around 77.3 years, a 40-year-old is expected to live an additional 37.3 years. And if they take a risk that has a 1% chance of fatality, then their total LLE, or loss of life expectancy, is calculated at 0.37 years, or 136 days. Now keep in mind, this doesn't mean that if you take that risk you're going to die 0.37 years earlier. It simply means that when you divide this risk amongst all the people that take that risk, it just puts a quantitative value on what that risk means. Putting this in perspective, and just in terms of how risky that behavior is, this LLE gives us an opportunity to really start to measure risk up against each other so we can sort of minimize the risks that are avoidable. Now, most risk is very small, and so a lot of it that you're going to see today is going to be reported in days or minutes. So here are a few of the risks that many of you are familiar with, and this is listing them in terms of their days of LLE, or loss of life expectancy. And what you can see here is one of the risks that we all understand quite well is smoking cigarettes, with a risk of about 2,300 days. Interestingly enough, being unmarried carries with it a risk that's not that much less than smoking. Lack of a college education, about 950 days of risk in terms of LLE. For those of us carrying a few extra pounds, being overweight 30 pounds is going to be about 900 days, and 15 pounds, of course, 450 days. Alcohol, motor vehicle accidents, air pollution, many of those things we're aware of. Driving a small car versus a mid-sized car, 60 days. Increasing the speed limit by 10 miles an hour, and there have been many studies where that's actually been done in a number of states, and the fatalities increase similarly to this risk calculation. A surprising one here is coffee. A lot of us do drink our coffee, and 2 cups of coffee per day throughout your life is going to give you a risk of about 26 days. It's actually a greater risk than hang gliding or skydiving. Birth control pills is on there, drinking diet soda, a teaspoon of peanut butter, which is a little surprising to me, but there's some risks associated with things in peanut butter. Being struck by lightning is down there toward the bottom, and you can see just below that we have our 3D orthodontic X-ray, which I talked about in the last podcast, and we're going to get a little bit more in detail about overall dental X-rays as well. Crossing the street also has risks associated with it. But to look at this bottom tier of risks, and this is kind of where we're living with dental X-rays, being struck by lightning carries with it about 20 hours of loss of life expectancy, or LLE. And a typical cone beam X-ray, for example, those that I'm taking in my office, have about 15 minutes of LLE. And crossing the street, we all know that there's dangers inherent to crossing the street, and many of the health physicists have calculated this as just about 4/10 of a minute is your LLE risk for just crossing the street. So I introduced in the last podcast the ICRP, and in this podcast I want to introduce you to the BEER committee, which is the biological effects of ionizing radiation. And many of the health physicists actually believe that the BEER committee is just a little bit more stringent in terms of how they report risk than even the ICRP. Now these are some calculations of LLEs for X-ray exposure. And a single exposure of 10 microsieverts has an LLE of 2.1 minutes. Now remember, crossing the street is 0.4 minutes, and continuous exposure at the ICRP's limit, no more than 1,000 microsieverts per year. If someone's exposed to 1,000 microsieverts per year continuously, means throughout their lifetime, the LLE is about 9.9 days. The background exposure, just the regular radiation that we get from living, this carries with it about 3,000 microsieverts per year, and if that's continued through our lifetime, which unfortunately it is, the LLE is about 30 days. So our background exposure compared to a single 10 microsievert X-ray is about 20,000 times compared to a single X-ray. Now, just kind of chopping down those LLEs into things that are a little bit more common for us, like drinking coffee and eating peanut butter and drinking diet drinks. If our 3D X-ray is equal to about 15 minutes of LLE, if we take that into consideration, and let's just pretend that we're going to be extra careful and multiply that times 10 instead of just 2, then we can get into where you're seeing 10 cone beam X-rays is about 2.6 hours of LLEs, and again, still below the ICRP limit and still below the LLE of being struck by lightning. You can see up at the top there, our 2 cups of coffee, which many of us are not going to give up, is about 2,500 times more LLE than a single cone beam X-ray. Now, a lot of the health physicists like to talk in terms of 15-minute LLEs, and the reason is this kind of gets the public more aware of just what 15 minutes of lost life expectancy looks like in terms of things that we do every day. So I want to go through a few things that cost us 15 minutes of LLE, and first, of course, if we smoke cigarettes, and if you just smoke 1.4 cigarettes, that's worth about 15 minutes of LLE. Drinking half a liter of wine, half a liter will cost 15 minutes of LLE. Traveling 300 miles by car is also equal to 15 minutes. 10 miles by bicycle, 6 miles by canoe will give you 15 minutes of LLE. And if you're one of those who has the extra 15 pounds and you eat an additional 100 extra calories, that's about 15 minutes of LLE. Getting into the X-ray world, dental X-rays and specifically, 3 dental panoramic X-rays will cost you 15 minutes, and 15 cephalometric X-rays or bite wing X-rays will also cost 15 minutes. And a single cone beam CT, which is kind of where a lot of the energy information and risk information is coming at us currently in the media, this is equal to just about 15 minutes LLE, a single 3D X-ray. Crossing the street 38 times will give you the same amount of risk in terms of LLE. And of course, back to the very popular cup of coffee, drinking 26 cups will give you about 15 minutes LLE. Now this is an interesting cartoon, and I put it in there just to kind of emphasize just how we manage risk in general, and it says here we've considered every potential risk except the risks of avoiding all risks. And certainly there is some risk to avoiding all risk, and it doesn't make life very enjoyable if we try to avoid all risk. And some general thoughts regarding risk, and these are just kind of things to get us back in tune with what the health physicists are talking about, and just kind of getting risk back in perspective. And the great majority of us don't actually understand the quantifications of risks, and mostly the reason we don't quantify things is if it did, it would make our life quite unenjoyable. Risks that are imposed on us by others are generally considered to be unacceptable, and this goes along with dental x-rays for that matter. Even though the risk is less than our cup of coffee per day, if it's something that someone else is asking us to do, it's very difficult to accept risk that someone else imposes. Whereas if we have a choice, be it drinking coffee or flying on a plane or drinking alcohol or even putting on those 15 extra pounds, we consider it a little bit more acceptable than if someone just imposes a risk on us, for example, a dental x-ray or medical x-ray. Now, we can't minimize our risk in life by simply avoiding the things that we happen to be thinking about or those that are brought to our attention. And the biggest area, of course, is the media. And unfortunately, the risks that we most often think about are the ones that are most publicized by the media. And the coverage in the media often omits quantification because if you remember from that chart, we're really at the very, very low rungs of risk, and there's really not a lot of publicity in talking about the dangers of alcohol or cigarette smoking, and even though they're far greater than these other risks, they don't capture the public's attention quite as much as something that's new or something that is kind of presenting a risk, albeit incredibly small, that the public's not yet aware of. And this, of course, results in an inaccurate guide to the actual dangers because it really doesn't represent a significant risk compared to what we're already doing. Now, the logical procedure for minimizing risk is to simply quantify all the risks relative to their benefits and then choose the ones that have the most favorable ratio. And I think it really comes down to the emotional response we have to risk far more than the quantitative response. So to bring a little bit more of the quantitative response to risk as compared with the emotional response, I've created this hypothetical cost of risk based on LLEs. And the top line, if you look at our total life expectancy, which is about 77.3 years, and if you imagine that life expectancy was a home, for example, and this home was worth $1 million, and various risks have costs associated with them, and they decrease the value of our home. So, for example, if you choose to smoke cigarettes, the risk is going to decrease the value of that $1 million home by about $81,000. And if you decide in conjunction that you're not going to attend college, it decreases it by another $33,000. If you have a few extra pounds and you decide to carry those around for your lifetime, again, you're decreasing the hypothetical value of that $1 million house by another $16,000. And just by choosing to do these top three things, you've decreased the overall value by a risk of about 13%. So many of these things are in our control, and of course we want to get rid of those if we can. So we want to avoid cigarettes and try and get as much education as we can and try and stay in our normal weight range. And things like coffee, this is where the risk gets a little bit lower, and a lot of us, in terms of a valuation of $1 million house, if it changes by $920, it's probably going to be negligible. And we're not going to lose a lot of sleep over that, which is exactly why coffee remains as popular as it is, although these risks of coffee have been well documented. Now, all the way down at the bottom of the chart, you can see where our orthodontic X-rays are. And cost for a single cone beam CT is about 35 cents. And a traditional, or the more common orthodontic X-rays that many orthodontists are using, a pan and a ceph, the cost there is about 17 cents. So current information that's coming across in the literature is really talking about the relative risk between these bottom two numbers. And when we look at the overall value of our life for this hypothetical house of $1 million, we're having this very strong emotional debate in terms of moving forward in orthodontics over 35 cents versus 17 cents. And this is important to put this risk in perspective. Now, of course, we'd like those numbers to be zero, but again, in terms of other things that we do, one might consider these negligible in terms of quantified values. Now, emotionally, they have some resonance, but quantitatively, and recall that the numbers are really just the numbers, quantitatively, these are quite negligible. Now, of course, in dentistry and medicine, we have something called the ALARA principle, which is as low as reasonably achievable. And all of us doctors want to practice the ALARA principle when it comes to X-ray exposure. So all of us are really trying to keep the exposure down. And as we discussed last time, the two different orthodontic options that are on the table right now are the traditional panoramic and cephalometric X-ray versus the 3D X-ray on the right. Now, keep in mind these are both extremely low in terms of risk, and we're looking at the cost in $1 million of LLE, 17 cents on the left, 35 cents on the right, and the information on the right 100-fold in terms of detail and accuracy as far as I'm concerned as an orthodontist, and the cost is a very, very negligible increase. Now, keep in mind those numbers or those images on the left, these probably cost about 2 to 3 times more than they do now 20 years ago. So in the 80s, when I was treated with orthodontics, the exposure was probably greater than the 3D image on the right. And I believe as technology increases, these costs do come down, and so it's really just what we're looking at right now in terms of X-ray exposure in dentistry and orthodontics in particular. We're just looking at a migration to better technology, keeping the risk very minimal. Now, as I discussed before, if you're in fact taking a more comprehensive orthodontic series, this is, in terms of cost, pretty much identical. You're looking at 34 cents versus 35 cents, and if you're not using rectangular collimation, which I hope all dentists are, over on the left you're going to quadruple that cost, which of course makes the 3D X-ray on the right even more attractive. So a lot of it really comes down to quantifying how minimal the risk is and quantifying what the benefit of 3D X-rays, for example, on the right versus two-dimensional X-rays on the left. Do those benefits outweigh the risks? And when we quantify things and when we really look at how small the risk is, and this is a chart that I hope really represents the take-home message. X-rays and what we do in dentistry, and certainly what we do with three-dimensional X-rays, these are very, very low, and when you look all the way down to something like crossing the street, these risks are quite low. So in the next podcast, we're going to discuss the benefits of cone beam or three-dimensional imaging in orthodontics in particular. And we're going to talk a little bit about how those benefits really start to emphasize why moving to this technology is so important in the profession, and how it's going to bring better treatment and better understanding of the craniofacial complex. So risk, of course, I think we'll all be happy to know that the risk is extremely small, and I think we can all kind of rest easy compared to what we're doing with our lives, that dentistry and medicine is keeping the X-ray risk very low. And I will be back in future podcasts and share with you more information.